Welcome to the WRAL Daily Download. I'm Jack Hagel. North Carolina Governor Josh Stein ordered lawmakers to return to Raleigh this week to hash out a deal on Medicaid funding. But the lawmakers say they're not coming, underscoring continued discord over health care for millions of low-income North Carolinians. WRAL state government reporter Will Doran has been covering the fight for funding, and he joins us now. Will, good to see you again.
Nice talking to you.
Before we dive into the controversy, just hit us with the basics. What is Medicaid? What does it do? And how many North Carolinians benefit from it?
So Medicaid is actually the largest single health insurance program in the country. There are tens of millions of people nationwide on Medicaid, including about a little over 3 million here in North Carolina. And we have about 11 million people living in our state, so you can do the math. That's nearly 1 in every 3 North Carolinians are on Medicaid. And actually close to half of those are children. This is mostly aimed at single moms with kids and other low-income families. There are some exceptions to that, but that is kind of the main target audience for Medicaid.
And how does it work?
Well, you go to the doctor and you get treated like any other patient, but instead of, you paying premiums to your health insurance company, the government picks up the tab.
Now, there's this big battle over funding. What's going on there?
Yes. Here in the state legislature, we're actually the only state in the country right now that does not have a new budget. And that has had a lot of different knock-on effects, including Medicaid is not quite up to the level that it needs to be at. Now, we don't work like the federal government where we go into a shutdown here in North Carolina. That doesn't happen. We just keep operating on the previous year's level of funding. But, everybody knows that healthcare costs have been rising. The amount of people on Medicaid has also been going up. So, the previous year's amount of funding isn't enough. And so we're short. Now, the legislature has put some extra money into Medicaid, even, basically acknowledging that they're not going to get a budget passed. But even what they agreed to do there was not enough. So we are still behind on funding.
Now, for a while, the Senate and the House weren't in agreement over how much to kick in. What is the shortfall and where are they on the numbers?
It is about $320 million that we are short, and basically everybody agrees on that. There's not really a whole lot of disagreement on how much money is needed to be spent, and there's not really any disagreement on whether that money needs to be spent at all. I mean, both the Senate and the House have voted to spend this money, but they're just refusing to vote on the other chamber's bill approving the money because of basically unrelated political fights, and so we're just in this stalemate where nothing is happening, even though everyone, Republicans in both chambers of the legislature and Democrats in the governor's office and DHHS, all agree that this needs to happen and should happen.
So the House and the Senate are run by Republicans, and now Governor Josh Stein, who's a Democrat, is intervening in this debate. He ordered lawmakers to come back this week to hash out a deal on Medicaid funding, but they're not listening to him. Why not? What are they saying?
Well, the state constitution gives the governor the power to do this, to call a special session and order the legislature back to Raleigh. And that's exactly what Governor Stein did. It was just over a week ago. We were there at the Capitol. He was announcing the special session. But then just a few days ago, we heard from GOP leaders that they are just going to ignore those orders. They say that it was unconstitutional because specifically the wording in the Constitution is that the governor can only do this under extraordinary circumstances. And they just simply don't think that this passes muster as being extraordinary. They say this is just a kind of routine run-of-the-mill situation, and they don't think that the governor should be trying to micromanage their schedule. They don't want to be in Raleigh, and they're not going to do it.
Is there anything that's going to happen to the lawmakers for not showing up?
No. Feasibly, I suppose the governor could sue them, but that's not really going to accomplish anything, even if he does win, and there's no guarantee that he would win. But, he can order a special session to make them come back, but he can't make them actually take a vote on anything. So even if he did sue them and a judge sides with him and says, yes, legislature, you must come back to Raleigh, then okay, they come back in, and 1 minute later, they just adjourn the session and go back home. So I think that we are just kind of in this stalemate, at least for the foreseeable future here.
Well, let's take a quick break. When we come back, we'll hear about what state health officials are saying. Stick around. Welcome back to the WRAL Daily Download. We're talking with WRAL state government reporter Will Doran about a fight over Medicaid funding in North Carolina. Will, before the break, we talked about how the Senate and the House are generally in agreement over how much more to fund Medicaid. They're roughly north of $300 million. Is that figure in line with what state health officials say? After all, they're the ones who are administering this.
Yeah, everyone is basically in agreement over this. And of course, things could change as the months progress. And obviously, all the state's economists and fiscal analysts are going to be looking at this. The executive branch has their economic people. The legislature has their own economic people. So, they could continue kind of changing the numbers as time goes on. But in general, yes, there is broad agreement from all sides over roughly how much money is needed. And like I said, just the idea that we should actually do this money. Can't be repeated enough that both the House and the Senate have individually voted to do this, to fund this money. They just are not able to agree on the exact details of how to do that and how to get it to Governor Josh Stein to sign into law.
What are the hangups?
It's a completely unrelated fight because, as I mentioned, we don't have a state budget right now, and that's due to a whole lot of different reasons. But one of the fights is related to a big children's hospital project that something that Duke and UNC are partnering to build, and the state has agreed to chip in some funding. The House wants to actually cut the amount of funding that the legislature already agreed to back in 2023. The Senate thinks that is bad policy, that if they agree to fund something, that you need to stick to your word. And so the Senate is basically saying, okay, we'll agree to fund Medicaid as long as the House agrees not to touch this children's hospital money. And the House comes back and says, well, we can have that conversation, but that needs to be done as part of, the budget when we negotiate on the big budget, and it doesn't need to be tied to Medicaid. Let's just go ahead and deal with the Medicaid issue now and leave the children's hospital thing for later. And that is the hang up here. It's not any sort of details about should we be funding Medicaid? How much should we be funding Medicaid? They agree on all of that. It's just this completely unrelated fight on, okay, do we use this to leverage a deal on something else or do we not?
This is a federal program, right? Is there any chance the federal government will kick in more cash?
No. Obviously, President Donald Trump has been trying to cut federal spending. He is not going to want to increase federal spending. And, the federal government already pays the vast majority of Medicaid anyways. It kicks in nearly 75% of the funding for this program. We're just talking about, the state's share of it, which, again, is mostly funded. It's just, a fraction of a fraction that is not funded, but that fraction of a fraction still comes out to hundreds of millions of dollars.
So in the absence of additional funding, what are state health officials planning to do?
Well, they're going to cut what they pay to healthcare providers. So if you are on Medicaid and you go to the hospital, to the doctor, to a specialty health clinic, anything to go get healthcare, normally there is a set rate that the state says, okay, this person's on Medicaid and we'll, for this specific procedure, we will reimburse you X number of dollars. Well, for most providers in the state, they're facing now a 3% cut to what they've been expecting and budgeting to receive. And some of them, especially the specialty ones, are facing 8, even 10% cuts. And so, if you're a hospital, doctor's office who has been, expecting to receive a certain amount of money and suddenly you're going to receive several percentage points less than that, well, if you're not operating on big margins anyways, the belt's getting pretty tight. You might need to think about, are you making staff cuts or, trying to cut back otherwise.
Well, how else might they cut? I mean, what does this mean for patients? Or are they going to lose potential coverage? What does that look like on the patient's end?
Yes, I'm hearing that that's actually already happening. I spoke with DHHS Secretary Dev Sangvi, who is the state's top health official kind of leading all of this. And he told me that already they're hearing from providers, one, who are just shutting down Medicaid entirely and saying, we're just not going to do any Medicaid patients at all. But probably the bigger group, he said, is folks who are saying, we're just not going to take any new Medicaid patients. So we're going to, keep seeing our existing patients who are on Medicaid, but we just don't have any appetite or ability to take on new patients who are on Medicaid. And so, for people who, might get referred to a specialist for something that pops up in their health, that could be really bad news. Medicaid covers a ton of births here in North Carolina. I think it's close to 40% of all of the babies who are born in the state are covered by Medicaid. So if hospitals start saying we're not going to take any new Medicaid patients, that becomes a real problem for pregnant women.
So lawmakers have already said they're not coming back this week. They're not going to listen to Stein. But is there any chance that they decide to come back on their own and cut some sort of deal before the end of the year?
No, it's the holidays. They want to be back at home with their families, enjoying the holidays. I mean, and it's really rare for the legislature to even be in session this late. You know, the budget is due in July. Typically, they're supposed to have wrapped things up by late summer, early fall. The only reason that we're talking about, being here on the holidays is because they haven't been able to get that done. But they've been pretty adamant that they just have no interest in doing this. And for the record, Republicans say that these cuts that I was just talking about, that DHHS is implementing on the providers, they think that that was premature. They think that DHHS could have waited until next year, early next year, to start doing some of those cuts. DHHS says, look, we have no guarantee that y'all are going to come back and fix this. You haven't been able to pass a budget. You haven't been able to pass this standalone Medicaid funding. The cuts had to start at some point, and it's better to start them now, ease it in at just this 3% rate rather than, just hit somebody later on if it's, February, March, April of next year with potentially much bigger cuts if it turns out that the legislature just can't figure out their disputes and can't address this at all.
Well, we know that you're going to be following these developments and covering them along the way. Thanks for your reporting, Will.
Yeah, nice talking to you.
That's WRAL state government reporter Will Doran. For his recent reporting on the battle over Medicaid funding, go to the NC Capital section of WRAL.com. I'm Jack Hagel. Thanks for joining us, and thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.